Hello, and welcome to the Adoption and Fostering Journal podcast. And we are joining some of our authors today from the October 2025 edition. It's volume 49, issue 3. So yes, very exciting. I suppose we should introduce ourselves. First of all, I am Vicky Walker, the production editor.
And I'm Dennis Gorham, I'm the editor-in-chief.
And the article that we're talking about today is Mental Health Status of Orphans and Vulnerable Children in Residential Institutions in a City in Southwest Nigeria. And the lead author of the article is Mercy Aladegboye, who is joining us at the moment. And we've got two of her co-authors as well. So we've got Dr. Femi Olowekere and Abiola Komalafe, Dr. Abiola.
Okay, well, I guess a good way to start is always if our authors tell us a little bit about themselves. Mercy, if we start with you, if you introduce yourself, what you're doing, what your research, generally your research interests are, who you are,
Okay.
for our listeners, and then if the others introduce themselves afterwards, maybe.
Okay. Thank you, Dennis. I'm Mercy Aladegboye. I'm a nurse by training, and I'm registered in Nigeria as a nurse as well as in the UK. My research focus is generally on orphans and vulnerable children, and I also work on sexual and reproductive health. I had a good background of research from Nigeria before relocating to the UK. And I currently work now in the UK with University Hospital Dorset as a research nurse. And I will be defending my PhD thesis tomorrow. So, yeah. So that's a bit about me.
That's very exciting.
Yes, so by the time this podcast comes out, yeah, that will be out the way, which is a nice thought, isn't it?
Yeah.
Yeah. Oh, they've got a big moment.
Good day, everyone. I'm Kemi Olowokere. I'm a professor of community public health nursing. I work as a lecturer at the Department of Nursing Science, Obafemi Awolowo University, Ile-Ife, Osun State, Nigeria. I'm a researcher. I'm a teacher. I also work in the area of sexual and reproductive health, but majorly I focus on research with vulnerable population. And I've been working with vulnerable children for quite a while, for some years now. I also participate in most of the national survey on vulnerable children in Nigeria. So it's great to be here today, and I know that it's going to be very interesting. Thank you.
Oh, well, we're so pleased to have you joining us.
I'm Abiola Komalafe. I'm a registered nurse, midwife, and public health nurse here in Nigeria. I'm a lecturer and also a researcher in the Department of Nursing Science, OAU. My research focus is sexual and reproductive health, and I'm happy to be here. Thank you.
Oh, we're happy to have you. Very exciting. And I think maybe to start us off, it would be good to learn a bit more about the care system in Nigeria. So particularly, maybe how children come, because your research focused obviously on children and young people in institutions in Nigeria, and just to help our listeners understand how children enter institutions, so to help us a little bit understand the care system in Nigeria.
Thanks for that question, Dennis. So Nigeria as a country, in line with international standard and best practices, Nigeria believes that children should live within the family settings and with their parents. But in the event of if that is not possible because of many reasons, and then there is a room to sort for an alternative care for that child. So currently in Nigeria, there are a lot of alternative care system available, which could be formal or informal. So the informal one has to do with the kinship kind of alternative care system, where children live with extended family member at their own discretion or at the discretion of extended family members. And that's the most common kind of alternative care we find in Nigeria. There are other types which are usually formal, which are the foster care, the adoption, which are less common, and residential institutions are one of the most common form of formal alternative care that we have in Nigeria. And children come into residential institutions for a lot of reasons, ranging from being orphans, maybe double paternal or maternal orphans, or being abandoned by their own parents, for social reasons, for abuse reasons. I've encountered children who were in the orphanage because their father was abusing them. So in order to protect the rights of the child, Nigeria also put in place systems to ensure that children are being protected, and that's where alternative care system comes in. So I think that's just a brief about alternative care system in Nigeria. So for children entering residential institutions, the governments are usually involved, and that's where the administrative and judicial body comes in. So for a child going into residential institution, in Nigeria, there is a central body, which is the Federal Ministry of Women Affairs, that coordinates issues that relates with child welfare at the country level. And then each state in Nigeria, we have 36 states. Each state, like county, like we have counties in the UK. So each state in Nigeria also have the State Ministry of Women Affairs that coordinates the welfare of children at the state level. Okay, so that's just a bit about the care system in Nigeria. I don't know if you have further questions.
That's fine. I think you mentioned one term in your article, which is and you just mentioned obviously that children can be double orphans, or that maybe one of their parents are deceased, or that maybe
Yeah.
they enter the institutions because of abuse. I think in your article you also mentioned the term social orphans. Can
Yeah.
you maybe just briefly say what that means or what that refers to?
Okay. So social orphans are children who have a living father and or mother, but they are in the orphanage because their parents are not able to take care of them, not because of death, but because of various reasons like poverty, financial constraint, maybe divorce or abuse, or for any reason. And you can see in our article that it's the foremost reason why many of the children, like most of the children in this study, are social orphans, meaning, and they were in the orphanage because of financial constraint of their uh, parents. So their parents could no longer afford to take care of them as a family, and then they take them into the orphanage or residential institutions.
Maybe let me add to that. Sometimes some of these children are also there because the parents are chronically ill and they could not care for those children. So they find their way to the residential form of care in Nigeria.
Okay, so they're both alive, but not able, just don't have the capacity to look after the child.
Yeah.
What are the conditions in those residential institutions? Because we know institutional care has been criticized a lot across the globe.
Yeah.
And we know that the environment in institution differs vastly across countries as well. So it would be good to understand the conditions within the kind of Nigerian institutions.
Like we have in many low and middle income countries, resource is usually a challenge. And just like I was reading the latest issue of the guidelines for alternative care of children in Nigeria, which was published in 2024, they highlighted like poor hygiene and lack of needed resources in some of these residential institutions. And while I was doing this study, although that was not my primary aim of going into the orphanages, but from anecdotal evidence, I could also speak to that some of these orphanages are really struggling when it comes to resources, and they might not be at their best when it comes to hygiene, when it comes to food, and a lot of things that the children might need for their health and well-being. And I'm just going to hand over to those that are still living in Nigeria, who might really know what it is right now, because this study was conducted back in 2019. And so, yeah, I'll hand over to Professor Lowokere if she has anything to add to that.
Yeah, Mercy, thank you very much. I would like to say that when you talk about the environment or the condition of the institution, this depends on the availability of resources at a point in time. Generally, we know that in most of the faith-based own residential setting or private settings, they kind of control the number of children that they have based on their own resources. But sometimes in the government-owned institution, it's pretty difficult to control the number of children in that residential setting. So we have a lot of kind of overcrowding. And you know that when you have overcrowding, there are possibility for limited resources and the children not being properly cared for. And I remembered before Mercy started this project, there was a kind of desk review report that we did together while I was on a national assignment, looking at the status of the situation of vulnerable children in Nigeria. And we discovered that most of the activities going on, were not really on the ones in the residential setting, but mostly on community-based orphans and vulnerable children, those ones that are living with some people, guardian, or some parents that have low capacity to care for them. So when you get to some of these residential settings, especially the government-owned, we see a lot of overcrowding, limited resources, and people not having access to resources as much as they should to be able to care for those children. But in the faith-based own, you will discover that sometimes they have donors, they have resources from philanthropists within the community or churches, and also the private home. So they regulate the number of children that come into their own setting. So when those children are rejected within these other settings, they are likely going to go back to the government owned that will also take care of those children. So what we see there is overcrowding, and we have a lot of children in the government owned residential setting. That's the situation.
All right. So maybe I need to add that many of these residential institutions rely on philanthropists, like Professor Loke has said, NGOs, and currently the hardship in the country is also taking its toll on the ability to finance finance such residential institutions. And that is also speaking to the fact that resources will be very few, and that has to be divided among many of these vulnerable children.
Yeah.
Kind of looking at the differences, what would be the largest number of children that you saw in one of the institutions you looked at versus the sort of the other end of the spectrum? What kind of numbers are we talking in terms of the ratio to caregivers as well?
Yes. So while I was on my study, I visited 12 orphanages, and it's just only one of them that was a government-owned orphanage. So others were private-owned and then faith-based organizations, okay? So there is no uniformity across these different kind of institutions. So each institution is unique in themselves. I came across about 2 of the orphanages that had less than 15 children as a whole in them, but most of the orphanages are housing as much as 50 children at a time. And so of course the government-owned orphanage had the largest number of children, but other privately owned orphanages too were housing a number of children close to 180 and just about that range. Yes.
What motivated you to do this piece of research? What did you want to find out? What were the aims of the study?
One of the motivation for me, because in Nigeria, it's one of our practices to go to orphanages or residential institution on charity ground.
Mhm.
So in the course of some of those visits, I saw the plight of those children. They really do not look well taken care of. And that was one of my motivation to really go deeper into what is it about care for orphans and vulnerable children. And so I would say one of my motivation is to contribute to improving the quality of care and quality of life of these vulnerable children. And that starts with providing data or facts and figures that policymakers can work with and with which you can make policy advocacy, right? So that was what bettered this study into researching into their health status. So this study is a part of a larger body of work which has been published. And so this is just focusing on their mental health. And also in line with that, in line with the United Nations Sustainable Developmental Goal 3, which aims at ensuring healthy lives and promoting well-being for all at all ages. And in seeing to the attainment of that goal as well, I believe that working on a study that will provide statistics on the state of health of vulnerable children in Nigeria is also a small piece of the big picture of attaining that global goal of ensuring healthy lives and promoting well-being for all at all ages. I wouldn't know if any of the other co-authors would like to add.
I think I've said that earlier. You know, when we were doing the desk review reports, we also observed that this group of children are neglected in most policy decisions and responses in terms of programming in Nigeria. And when we went for a larger meeting, you know, with the Federal Ministry of Women Affairs, some of these issues were actually raised by caregivers or NGOs that we need also to look at children in the residential setting. Let me say this, we are not actually promoting, the Nigerian government in quote is not actually promoting residential setting, no form of care. They want children to be within the family setting, to be raised within a family circle. But the current situation of the country, many of these children are rejected by the family because they could not cater for the children. So the children have to be moved to the residential setting, and there's nothing government can do because it's due to the economic situation of our nation. That is why we are now having more children in the residential setting than it used to be before. So some of these are some of the facts that we gathered while we were doing the desk review report, and we also want to research into it. If we look at some of the conditions of the children, vulnerable children outside residential setting, some of them are going through difficult moments. Some of these were reported, some of them were going through depression, anxiety. And one will think aloud that, so if children outside the residential setting are having this kind of problem, so what will be the stake of children in the residential setting that are not close to their family, not close to the parents, they are in the midst of other children, and they may have access to limited resources. And that is one of the reasons when we were conceptualizing this study, it's part of our MSc studies. That is one of the reasons why we also go into that area to look at their mental health status and their accessibility to mental health services.
Yes. And you did look at the mental health with a very large survey. I was very pleased to see the number of participants when you first submitted your manuscript, because you actually got responses from children's caregivers for 384 participants, which
Yeah.
is quite an achievement.
Yeah.
Yes.
So we were wondering whether you could, whether you could tell our listeners a bit more about the sample you assessed in your study.
The setting for the study, like Nigeria, is a state in southwestern Nigeria, and it was one of the biggest cities in Nigeria. And that was what motivated us to conduct the study. And it has a number of orphanages. So we selected 12 orphanages using multi-stage sampling from local governments down to selecting eligible orphanages from local governments within that city. And then, so selection of participants were from eligible orphanages, and we had inclusion and exclusion criteria. So those any orphanages that we're going to visit should be registered with the Ministry of Women Affairs, should have eligible children in them as at the time of study, and then should be willing for us to collect data from children. So if you look at the instrument that we use for data collection, the strengths and difficulty questionnaire has 3 versions: the children version, the teacher version, and the parent version. So we use the parent version, and we know that these children are not within the care of their parents. So the caregivers were like proxy parents. So they were the one that answered the question on the mental health status for each of the children. So we assessed and collected information from 384 children, and which was a calculated sample size from a previous study. There is a formula for sample size calculation that we used, and we arrived at that number. And so we distributed recruitment into each of these orphanages based, we call it proportionate sampling, based on the number of children those orphanages are having in them at the time. And then that would let us know the number of children to recruit from each orphanage until we meet the 384 sample size that we were aiming at. So that's just a bit about how information was gathered from the study from the study participants.
Yes, and you already said there were the largest number of the participants were what you refer to as social orphans, right?
Yes.
So technically children with living parents who are in the institutions for other reasons, and we talked about a couple of them. How old were the children, and more importantly, what I'm always interested, how long or how much time had they spent in the institutions at that time?
From the results of the study, majority of the children had stayed for between 1 to 5 years in the orphanage at the time. So children enter residential institutions at different ages, some as babies, some at 10 years, some at 12, depending on their unique circumstance. So a child might lose the mother at 11, and then there's no other option than for the child to be taken into a residential institution. So at the time that we conducted the study, majority of the children were living in the orphanage from between 1 to 5 years.
It's quite a long time, isn't it?
Yes, yes. Most times in Nigeria, when children come into orphanage, of course, there's usually a plan for them to be reunited into their family. But for a child to have really come into a residential institution in Nigeria, it means that's the last resort. And usually, that is usually the child's home until maybe age 18, when the child has to leave the orphanage, I would say.
What was the distribution in terms of gender?
So for this study, we had more male participants than female participants, and we could provide a reason for that because in Nigeria, it is believed that female children could be helpful with household chores. So we could say maybe some female vulnerable children were absorbed into extended family because those family members believe those children will be able to help them, while the male children were given up to find solace in residential care settings. It's just like a reason which we can't say it's been proven, but that could be a possible explanation to the data distribution by gender.
Yeah, cultural expectations and yeah.
I'm thinking by now our listeners are probably wondering, what did you find?
From this study, the questionnaire we used in assessing the mental health status of the children is a screening tool. It's not a diagnostic tool.
Yes.
It's just a pointer to say, oh, these children, if they have this score on these instruments, they might be needing further intervention. So from this study, about 46% of these children had abnormal score on the strength and difficulty questionnaire, and another 20 something percent had a borderline score. So from taking a look at the strength and difficulty questionnaire, once a child has a score that falls within the borderline, as well as that also falls in the abnormal category, that child is at increased risk of mental health intervention. So grouping these scores together, we have about 66%. That's above average of these children from the results of this study that need further mental health assessment and might likely need further mental health support. So, and we also, taking a look further, we also assess these children's accessibility to mental health services. And we discovered that it's only a few of them that have access to mental health services, which wasn't a regular practice. They only accessed the service when people came in to visit them on charity ground.
Right.
Yeah, so there is a gap between the mental health needs of these children and the availability of mental health care services, which this study was particular about, and which we were able to highlight. So that's about just the result of the study.
So that means we have a very vulnerable group of children who live in much less than ideal circumstances, with exposed to a number of risk factors. And then we know that the majority of them, to 2/3, likely benefit from mental health support, but
Yeah.
that support is basically not available.
Yeah.
Yeah.
And I think you also analyzed some association with some socio-demographic factors.
Yes.
Do you want to tell us about those?
Yes. So from the socio-demographic characteristics, we found out that orphan status and the type of residential institution that that child is living in is associated with abnormal difficulty score. And when we took that from bivariate to multivariate level, we discovered that maternal orphans and children who were residing in government-owned orphanage are twice as likely to be at risk at developing mental health difficulty when compared with other category of children. And it's still buttressing the results of the study again. And that finding is not surprising to me, because like Professor Olowokere mentioned earlier, that government orphanage is overcrowded and with the tendency of having very low caregiver to child ratio. And we know that having appropriate ratio of caregiver to child helps a bonding process, which these children obviously lack. And studies have identify the importance of a positive parent-child relationship to mental health of children. So when we have many of these children living in a dormitory style of orphanage, so there's a possibility of a very little or no parental relationship, because of course the caregivers are very few, and then they have to tend to a number of children. And more so, this next to social orphans were maternal orphans. And for a child to be a maternal orphan, it means that that child has lost his mom, and then is still speaking to the lack of parental relationship. And all of this has a significant effect on the psychological development of a child. And we can see the gap in the mental health assessment of this child. So yes, that's just a bit about the association between the mental health difficulty and the social demographic characteristics of the children. I don't know if any of the co-authors would like to say something more apart from what I've said.
I think you've said it all, but I like to raise the importance of women to raising kids in Nigeria, in Nigerian context. We know that most times the men, they go out, in terms of gender roles in our own society, men are the ones that go out to look for what the family will eat and what they and take major responsibilities in the family. So, but the women are closer to raising the kids and caring for children. So in most of the studies that I've found out with vulnerable children, we see that when children are when we have maternal orphans, they tend to have more difficulties than other forms of orphans, like the paternal orphan or social orphan. The role of a mother cannot be overemphasized, especially in Nigerian context, because the gender stereotype is that women are supposed to care for the family, love their children, and also raise the children. And most time, they are often with the children to raise them and to give them the necessary support. The attachment also. But when you find a child in the residential setting, you know, it may be difficult for that child to be attached to the caregivers because there are many. There are many. So the caregiver actually may not really have time for all the children at the same time to be able to give them the necessary attention for them to be able to have a healthy lifestyle. So I think that could be responsible for the findings of the study. And it's only that stereotype is just coming in, even in the institutional setting where the data were collected.
So it's kind of the loss of in that case, primary caregiver,
yeah,
contributes to the mental health needs.
Also, also to chip something in there, from our study, you discovered that next to social orphans, maternal orphans are many. You know, in our study, we have almost 84 of them. You know, that's next to 212 double orphans. You see that maternal orphans are also many. Also pointing to the fact that for death of mother, these children are going to be put in these orphanages, you know. But when it is as a result of death of fathers, the mother still struggled to take care of the children, you know, not putting them in residential homes. But when the death of mother is involved, you know, because fathers could not take care of children as a woman would do, they prefer to put them in orphanages.
And in those situations, is it normal for there to be some level of contact, or would it be a kind of severance of any contact between the child and their existing family?
It depends. You know, for many children, some of them, they can't even trace their family. Because some children, maybe because of war and insurgency that were going on in Nigeria at some point, ended up in orphanage. But for children who maybe it was their father that brought them into the orphanage because of maternal death, usually the father still show up to visit such child, yes, and then at times still even provide for some of the needs of the child. It's just that the father is not in a good place to provide the maternal care that a mother would have provided. Some other instances are that the mother is late and then the father marries another wife who is abusing the child. So the child has to be taken to a residential institution just for the safety of that child. So for such child, it is unlikely that the child will go back into the family. Of course, the father might still be responsible for the child while the child is still in the orphanage. So it's a lot of dynamics depending on the child's unique situation and circumstance.
Okay. So I also want to say, in addition to that, for social orphans, sometimes the parents do come once in a while to see the children. But I want to raise the point that it's not like when you are living with your own mother.
No.
But when you walk into this residential setting, they have visitation time, they have different kinds of activities that they do. That bonding between a mother and a child, they may not be able to achieve that with the time that they visit the orphanage. So I think that is also another factor that we may experience with the social orphans. And I like to say that some of these parents of the social orphans also do provide for the needs of their kids once in a while. When they have money, they bring to the institution to support their own children as well, like Messi said.
It's quite a complex situation, isn't it? Why
Yeah.
children end up living in institutions, right? So, and even though some parents obviously visit and want to care for them, they can't because of economic hardships, for instance, and they try to do what they can by the sounds of it.
Yeah.
Yeah.
And to also buttress that point, currently, the National Bureau of Statistics shows that more than 50% of Nigerians are living at poverty level. That's like having less than $1.25 to live on in a day. And that speaks volume. Yeah, it speaks volume. So before now, vulnerable children are usually absorbed into the family system. But even these days, because of poverty, families are not able to play that role as it used to be. So it's a lot. Yeah, it's a lot.
That makes sense.
The other question I had was, because we obviously talked about the mental health needs, but I was wondering, obviously the strengths and difficulties questionnaire has different types of mental health problems that are assessed. So like emotional problems, for instance, inattention, hyperactivity is assessed, peer problems. Can you comment on maybe the distribution you saw in mental health needs across maybe different subscales within the SDQ?
The prosocial scale, for instance, a high number of the children have normal score on the prosocial scales, and which is very exciting. Looking at the fact that because the SDQ has 5 scales, 4 are the difficulties, and the prosocial is like a good part of that assessment. That if a child has a normal score, and that's a good one. So it also speaks volume to the fact that despite their mental health difficulty, they are still able to show some sociable skills, which is quite commendable. But going down to conduct and the peer skills, a number of these children have abnormal score on those skills. And for conduct skill, for instance, studies have shown that male children are at higher risk of developing conduct disorder. And if you look at the socio-demographic distribution of this study, we have more males than female participants. So again, that is still buttressing the work of previous author about males being at high risk of developing conduct disorder. And going to the peer scale as well, a higher number of the children also have high score on that scale. And again, that is speaking again to the fact that next to social orphans, we had higher maternal orphans in this study. And again, peer skills is also a very vital skill that is developed from positive parental relationship, which most of these children lacks. So yeah, talking about the skills, those are one of my observation, and is still also verifying the works of previous authors about some of these problems, and also the social demographic distribution of my sample population.
I mean, the important point also why you decided to do this research is to find out what to do and to get some arguments for policy changes with
Yeah.
Nigeria, right? So how could change be achieved based on your findings, or what are the next steps maybe?
Yes, I'm going to leave that to Professor Lowokere to answer because she's done a lot of work at the national level. But before she comes up, I would just like to say that Having data on important issues like this is a first step in the right direction, which this study has earmarked. And going forward, I would say that prioritizing mental health care services for these children is also a good policy recommendation, which I would like to say, because taking the United Kingdom and the United States of America, for instance, I know vulnerable children in the UK are usually referred to as looked after children, and these children are these children are on the priority list for mental health care service provision. Also in the US, a study on healthcare service provision for vulnerable children in the US also identified that this population are also on the top priority list for mental health service provision. But that's not happening in Nigeria. So I believe that prioritizing mental health care service for this group of children in Nigeria help uh would help prevent further deterioration in their mental health, and also promote their mental health and well-being. And I'm sure Professor Wolowokere has one or two other things to say based on our experience in working at the national level.
Thank you very much. Let me say this, that Mercy and the research team, generally, we have all been working on with orphans and vulnerable children. And I remember that before the last survey that we did a national pilot survey with orphans and vulnerable children in Nigeria in 6 geopolitical zones of Nigeria. The first thing we did was the desk review report. And in most of these studies, you see our work coming up, in most of these review reports. And so that gave us an opportunity, pointing to the direction of what needs to be done. Because what we did was to do a kind of a review of all the literatures on orphans and vulnerable children in Nigeria and to identify the gaps. And this gap were used to develop questionnaire that we use for the national pilot survey. Unfortunately, we were able to get the result of the national pilot survey, and we got to know that most of these services, including mental health services, are lacking, among these vulnerable children. So our plan, our next agenda now is for a full national survey, which we are already, which is in the pipeline in Nigeria. We want to do a comprehensive survey across the country, and then that will inform policy decisions on what we are going to be doing with vulnerable children, including those ones on the street and those ones in the residential areas. I would like to state that the data that we collected were also from residential institutions, from vulnerable children in the street, from vulnerable children in the community, from vulnerable children within the family, different households within the country. So we look at different categories of vulnerable children, and we are bringing out what are the priorities for these different sets of children. And I believe that by the end, by the time we are done with the national survey, the information will be useful for us to look into various recommendations for policy decisions at the national level.
Sounds very promising, and it's just I think it shows very nicely that you need a first step, which is gathering data to inform policy, right? And then and even though this is not an intervention study, it identifies a need and also lack of support, right? And then the next step is to do larger surveys and so on, and then maybe interventions. So I think it just illustrates nicely how many different research projects are needed, right, to eventually inform policy. But each of those are an important piece of the puzzle that hopefully at some point brings change, right?
Yes.
So in your study, you talk about the role of the nurse.
Yes.
And how that role could be used more for promotion of mental health, for prevention in these settings in residential institutions. So could you just tell us a bit more about that?
Yeah, so for nurses, we know one of our primary aim is to promote health and well-being, and particularly among the most vulnerable population. So currently in Nigeria, we have nurses working in schools, nurses working in prison, but you hardly find a nurse working in an orphanage.
Right.
Right. So we believe, of course, that is also speaking to availability of resources and still speaking to prioritizing mental health care service provision for these children, right? Because if you look at it, like if people or the government see a need for nurses to be working among children in school, then there should also be a room for nurses to work with children in residential institution. So I believe because nurses also specialize in mental health, they are mental health nurses. And so I believe if nurses are being employed, of course, I'm a nurse. I can't see a paid employed job and then leave it for a non-paid work. And that's why the only access these children have to these services were when healthcare workers visited some of these orphanages on charity grant. But that will not happen every day. So if nurses are employed, or maybe nurses from primary healthcare centers are given the responsibility to provide mental health care services for children in residential institution, I think that would also be, of course, there's always a room for training. So if they feel the nurses are not well trained enough to provide such services, they can empower them, like put them through courses, and then give them that responsibility to take mental health care services to these children. And that still falls within the purview of community health nursing in Nigeria. But because some of these roles are not being funded, you would not find nurses playing this role as they ought to do.
I want to start from where Mercy stopped, because right now in Nigeria, we are experiencing shortage of nurses, not even enough in our healthcare settings. I mean, clinical settings, let alone places like orphanages. So I am also looking at the possibility of having these caregivers trained to some extent, that they can pick red flags, among these children, so that they can now inform proper authorities, healthcare professionals about such children, so that they can have timely intervention instead of waiting endlessly till when nurses will be available in orphanages. Yes, we could have one or two nurses covering orphanages, but we should also think about capacity building for the caregivers who are taking care of these children day and night, so that before things get out of hand, they can pick these red flags and act appropriately.
So kind of training kind of lay people to deliver interventions, right? To kind of make up a little bit for the shortage of trained nurses who would otherwise be able to help, but obviously there's a shortage, there's no funding. So is that what?
Well, it might not
Yes,
be
even
exactly to provide such services, but if
no.
caregivers are trained to identify or to even be able to screen children, that's
Yeah,
a bit of the work. And then if they
yeah.
feel, okay, this child I feel might be at risk based on my training on screening them on mental health, and then they can refer or take the child to appropriate healthcare services.
Yeah.
Yeah.
Thank you. Thank you. So to put it right, I'm just talking about screening and referral.
Okay.
Which will, yes, screening those children,
But
to be
mostly
able to
screening and
identify
refer. Yes.
some of them that are at risk, and so they can refer before
Yeah.
things get out of hand.
And that's speaking to primary prevention.
Yeah. Please let me say this. Don't forget that, nurses have autonomy at the primary healthcare level. even the care of people in the residential institution are under the primary health care facilities. Just like we do in schools. Nurses go to school to screen children and then make referral from school to the hospitals. We could also schedule such things within our activities at the primary health care level. The way nurses go to schools from primary health care facilities to assess school children, they could also do the same thing to children in the institution to assess them from time to time and then make appropriate referral to healthcare facility for necessary intervention. And nurses, when we talk about the largest number of healthcare providers in Nigeria, nurses, they are the largest number of healthcare providers, and they have a lot of roles to play. And one of these roles is what I'm talking about, that if nurses can do their job, if we can structure the primary healthcare facilities in such a way that nurses would be able to do this, then they will refer. These children can have access to mental health screening and support, from time to time, and this could help us to reduce the consequences of not addressing these problems as early as possible.
I feel there's a very, very, very emotive and a very strong statement of what needs to be done, right? And it's and I keep thinking, wouldn't it be nice to already be there? Because obviously the children need the help now, right? But I think this also emphasizes how important and timely the work is you're doing, and I'm very, very happy that you're on the podcast with us to talk about it.
Thanks, Dennis.
And I'm having an eye on the time, which is telling me that we probably need to stop, even though I feel like we can continue talking for hours, and we might continue talking after we stop recording. Who knows? But our listeners will never know.
Daunting. No, it's been so wonderful to have you. We really enjoyed working on the article with you, but yes, to have you speaking with us on the podcast is fantastic as well. So to be able to publish your work and speak to you about it is really, really brilliant for us. So thank you so much for both the article and your time today.
Thank you.
Thank
All
you,
right,
Vicky
thank you.
and Dennis. Thank you for having us.
Thank you, everyone, for having us. Thank you, Dennis.
you.
You
Yeah.
made the interview very interesting, and
Very
Vicky,
well.
it's so nice speaking with you guys.
Yeah.
Thank you so much.
Thank you.